Today, my guest is Brad Stanfield, a medical doctor from New Zealand and a passionate ambassador for longevity. Among other things, Brad runs a widely popular YouTube channel where he discusses latest research, exercise, diet, supplements, and other longevity related topics. Hello, Brad, and thank you for joining us. I'm actually a big fan of your YouTube channel, and in particular, I like your critical takes on research papers, where you expertly dissect them and pointing out their strengths and weaknesses.
Yeah, thank you very much. Yeah, what I try and do on the channel is just to get the word out there because, there's so many things that people can do now to help their health, and there's exciting research to come through. So yeah, it's an honor to be able to report on that and get the word out there.
Healthy longevity is the goal for many people, especially now. But what are the best things we can do now to increase our odds of living a long, healthy life?
Yeah, there's a lot of things that we can do. And I think it's very exciting to report on all the upcoming research that's coming through. But as you say, we need to focus in on the here and now. So it stems back to diet, exercise, and sleep. And I think we need to just nail those basics before trying to do any exciting and wonderful things in terms of supplements. So, with diet, we need to make sure that we're not eating too many calories. We want to be eating a wide and varied diet with enough protein and with enough fiber. And once we've done that, then obviously we need to be exercising. So with exercise, in particular, we need to make sure that we're doing exercise that is significantly raising our our heart rate and our breathing rate. So I see a lot of patients in the clinic who say, I'm exercising, but the exercise is going for a walk or gardening, which is a great start. But we really want to see that heart rate and breathing rate going up. We also want to make sure that we are doing resistance training as well, so lifting heavy things, because as we age, our muscle stores, they decline, and that's one of the big markers of frailty. So we need to make sure that we are exercising. And then sleep is often overlooked in this space, and it's so crucial for our health. When you wake up and you're feeling refreshed, you're far more likely to go out for that run and practice those good healthy habits. So right. It's really those three things that we need to focus on. And then there's other things that are coming through in the research that look promising. Yeah, there's been a lot of research about the particular importance of vigorous exercise. But so first, can be considered proven? And second, is there a thing like too much vigorous exercise? Because there are also some research pointing in that direction as well. Yeah, overtraining is certainly an issue, but I think that's for elite athletes who are training multiple hours every day. I think for people who want to be healthy, generally overtraining is not really an issue, with the caveat that if you're doing high intensity interval training every day, that significantly increases your chances of injury and overtraining. So we want to make sure that, yes, we are doing high intensity interval training, but equally we don't want to do too much because of the risks of injury. So one of the things that I mentioned on my channel is that with high intensity interval training or HIIT workouts, we probably want to be doing that a maximum of about 3 to 4 times a week. And in the other times, we're doing different types of exercise, be it resistance training, yoga, Pilates, those sorts of things. So yeah, I think the concerns around too much training are generally overblown, because most people won't get anywhere near that threshold. I think, for most of my patients that I see in the clinic, I wish they were training more, not less. You're probably right. So a quick question about diet, because dietary studies are full of holes and internal, debates. What is your take on the healthiest diet available? I think the healthiest diet is the diet that you can actually stick to. So there's different pockets of people online where you can, talk about the keto diet or the carnivore diet or the paleo diet or the vegan diet. And yeah, it comes back to what is a diet that you can stick to for the long term. There's no point in yo-yoing. And so long as that diet is getting you enough protein, enough fiber, it's eating whole foods, and it's a wide and varied diet, that's what actually matters. A lot of the debate online, I think, is not futile per se, but I think it misses the overall picture, in that we do want to have a diet that is sustainable in the long run, that will give us those benefits for many years to come. But if you had to pick one diet that's the healthiest, we keep harking back to the Mediterranean diet. So this is a diet with lots of, say, fatty fish, nuts, seeds, whole grains. That's the diet that seems to have the most robust evidence to reduce heart disease. So if you had to pick one diet, that's probably the one to go for. But again, we just need to make sure that whatever diet you choose, that you can do it for the long run.
Well, yeah, thank you for this wise advice. So a lot of people take supplements. Let's move to supplements, right? In the hope that they might increase their lifespans and slow down aging. And you spend a lot of time reviewing the scientific literature around supplements. But what supplements do you personally use and why?
Yeah, there's a bit of a list of supplements, but I do just want to start by saying, again, no supplement will replace a great diet, regular exercise, and sleep. So we need to nail those three first, and then we can have a look into supplements. So the supplements that I personally take, I take 1,000 units of vitamin D, and that's because I primarily work indoors. I'm not seeing much sunlight. And when I do go outside, I'm always wearing sunscreen. So I know that without that dose of vitamin D, I'm going to be low. And from a British medical journal meta-analysis, I think it was published in 2018, they could see that people that had low levels of vitamin D, when those people supplemented with vitamin D and brought their levels back up to the optimal range, they had lower rates of the common cold. So there does seem to be an important link with the immune system and vitamin D. There was also a paper published from the VITAL trial, which is a 5-year study, and it showed that people who took 2,000 units of vitamin D compared to placebo, they had a 22% reduction in the chance of developing new autoimmune diseases. So there is a strong link with optimal levels of vitamin D and the immune system. But I want to stress here that I do not advocate for mega dosing. So you'll see online people taking, 10,000 units, 20,000 units. There are some safety concerns with that, despite what some influencers will say. So I stick with the medical guidelines, which is up to 1,000 units. The next supplement I take is omega-3. So we've touched on the VITAL trial already. Again, as that 5-year study, it also looked at omega-3. And what they could see is that there was a significant reduction in heart attacks. So interestingly, it didn't seem to stop people dying from heart disease, but it did seem to reduce the chance of having a heart attack. So I think that's a fairly powerful reason to take omega-3 supplements. The next one I take is creatine. So creatine, it had a bit of there were some initial safety concerns with creatine around kidney health in particular. And we've now got research going out more than 5 years showing that creatine is safe for people that don't have kidney issues. And creatine is fantastic to help with muscle recovery, with the workouts that you're doing, because it gives you that initial boost. And it also seems to reduce the risk of injuries. So I think creatine is one of the supplements that I don't think gets enough attention in the longevity space. I think it's a brilliant supplement. And the next one that I take is collagen. We've got strong evidence from many human studies, including a meta-analysis, that collagen supplements, particularly hydrolyzed collagen, it improves skin health. So if it's improving skin health, and by that I'm meaning, it decreases fine wrinkles, what other organs is it helping? Could it possibly help with, joint health? Could it possibly help with blood vessel health? And we don't have that research yet, but I think it's quite compelling that we do see those improvements in skin health. There's a few others that I take, but those are kind of the main ones.
Okay, thanks so much. Yes, it does sound pretty logical, and those two supplements that you mentioned frequently overlooked. But also, the supplement market, it's not all rosy there, right? It's rife with misleading information, marketing spins, and all kinds of other ploys designed to sell products. So how can people learn to evaluate better the studies and claims being made by supplement vendors?
Yeah, you're absolutely correct that it's a bit of a minefield out there. And I think one of the best ways to not be led down these marketing hypes, as you say, is to go into any research paper assuming that whatever supplement that they are trialing, that they didn't see any positive effects, that the trial wasn't particularly well conducted, and try and pick holes in that study. Because if you go into the study with a skeptical mindset, you're far less likely to be led astray compared to going into a study trying to confirm your existing ideas. So one of the things that that I think, well, one of the big reasons why I started my channel is that I noticed that a lot of supplements and other influencers, they were extrapolating from cell or mice data. They weren't looking at human data. So I think that's again a great place to start, is whatever study you're looking at, make sure it's a human study. The next thing you want to look at is, ideally, you want to make sure that you're looking at a randomized controlled study. So a lot of studies, they're observational studies. So for example, there's an exciting observational study looking at glucosamine, where it seems that people who take glucosamine, there's about a 15% reduction in their death rates, which is exciting. But we can't overinterpret that. That's an interesting signal. But what we ideally need is a randomized controlled study now, where you've got half of the population who will take glucosamine and the other half who will take placebo, to see if there's a true benefit of taking those glucosamine supplements. So yeah, those are a couple of strategies that I think people can use. And then obviously you want to make sure that there's enough people in the study to generate significant results.
Right. And I think you're doing a fabulous job in educating people about, very basic things that general public sometimes don't know, like to look at like sample sizes and p-values and the difference between randomized control trials and populational studies. So thanks so much, and keep up doing the good work. My next question is, let's move to rapamycin. There has been a lot of interest in rapamycin, obviously, and its potential against aging. But first, what is rapamycin and where does it come from?
Yeah, so we've known about rapamycin since the 1970s. It was actually discovered in a particular bacteria that grew from an island called Rapa Nui, I think it was called.
Right.
And when they first looked into this molecule, it had antibacterial and immunosuppressive effects. So because of the immunosuppressive effects, it's now used in clinical medicine to prevent organ rejection. So if you have a kidney transplant, one of the drugs that you'll be on is rapamycin to stop your body fighting that new kidney that you've received. So you might wonder then, why are we excited about a molecule that might be suppressing our immune system? And this comes back to research done by a group called the Interventions Testing Program. So this is a program that every year they select a group of molecules to test, and they run the same experiment in 3 separate labs at the same time. So you can make sure that the results that you're seeing are reproducible. So it's not just a quirk that you're seeing from one lab. And these labs, they also use genetically diverse mice. So a lot of the studies that you'll read, they use so-called black 6 mice, which is an inbred strain of mice. Whereas the intervention testing program, they use, a genetically diverse set. So it more represents humans. And over again, when they test rapamycin, we see a roughly 15 to 20% lifespan extension for both males and females. And excitingly, it also seems to work if it's used intermittently and if it's used later in life. So that's why we get so excited about it. But then you say, okay, well, that still doesn't address the safety concerns in humans, because we certainly don't want to be taking a molecule that's going to reduce our immune system and cause us to be susceptible to infections. So there was a human study of 264 people. This was published in 2018. And it was looking at the idea that if you took molecules to block an enzyme called Mtor, which is what rapamycin does, it blocks Mtor, will that actually improve our immune system? Because there's this concept called immunosenescence, where as we age, we start collecting all these old, damaged immune cells. And if we can clear away those old and damaged components and replenish them with new ones, will we then actually have a stronger immune system? And that's actually what they seem to find, that when they took a molecule that blocked Mtor, and they also gave the influenza vaccine, they could see that the people that had the Mtor blocker seemed to have a greater response to the influenza vaccine. So their immune system was actually stronger against influenza. So that's quite crucial, that the devil's in the detail here. When rapamycin is used to prevent organ rejection, it's used in combination with a whole host of other medications, and it seems to help those other medications work a bit better. But if we use rapamycin intermittently and by itself, that seems plausibly that will actually give us a lot of benefits. And that's why I've set up my clinical trial to look and see whether we can actually get extra muscle performance benefits if we use rapamycin once a week combined with exercise.
We don't know actually exactly how rapamycin works. There's still a lot of research to be done. But yes, you mentioned mTOR1, which is a pretty interesting protein. So can you just spend just a little bit more time telling us how this works, like about the inner workings of rapamycin, if possible?
Sure. So mTOR is a nutrient sensing enzyme. So when we have a protein meal, specifically if we have a lot of the amino acid called leucine, we switch mTOR on, and that signals to our cells that they need to start building, that they need to start creating new proteins. And rapamycin switches mTOR off. So you might say, well, why would we ever want to switch mTOR off? Well, when we switch mTOR off, we activate a different process called autophagy, or self-eating. So that's the cell recycling process. So when we activate autophagy, we are clearing away all the old and damaged components so that when we switch mTOR back on, we can create new mitochondria, new components. So it's out with the old and in with the new. And it seems that as we age, we are chronically switching mTOR on. It's almost like our body is trying to compensate for it becoming weaker. It's saying, we are becoming weaker. We need to create more proteins. We need to become stronger. But the trouble is, if you're always switching mTOR on, you're never really activating autophagy. You're never clearing away those old damaged components. So again, it's plausible that if we use rapamycin once a week or once a fortnight to activate the autophagy process and clear away those old components, then for the rest of the time, through exercise and protein diets, we're switching mTOR on and building new components. That's a really interesting idea. So yeah, I'm hoping that by, again, taking rapamycin once a week or once a fortnight, we can rebalance that mTOR signaling. So instead of always switching it on, we're having periods of time where we're switching it off as well.
Thank you. Yeah, that's a great explanation. In model organisms, when rapamycin is given throughout the lifespan or early in life, there's sometimes a trade-off between in terms of growth, right? So organisms grow slower. So do you have any concerns about the interaction between rapamycin and exercise, for instance?
Yeah, so that's one of the reasons why I designed my clinical study. So, when we're exercising, we tear our muscles, we damage our muscles, and that's a signal to them that they need to become more efficient to deal with that stress. And they do that by switching mTOR on to rebuild proteins and create new mitochondria. So if we're taking rapamycin, it's possible that we will actually make muscle performance worse. However, again, I think that if we take rapamycin on the days that we don't exercise and we take it once a week or once a fortnight, I actually think that will improve muscle performance, because again, we want to make sure that we're clearing away those old cell components so that when we are exercising and having those protein meals, we can rebuild new components and we're not hindered by all that baggage, all that old and damaged, all the old and damaged components. So I certainly don't think that humans will be taking rapamycin every day. I think, again, it will be that intermittent dose where we rapidly want to switch mTOR off and activate that autophagy process. But for most of the time, I don't think we will want to have rapamycin in our bodies. So there is that concern around muscle and muscle performance. But again, I think with intermittent rapamycin dosing once a week on days that we don't exercise, I do think that will improve muscle performance overall. And that's why I've set up my clinical trial in the way that we have.
Right. This is a really interesting strategy. And I actually wanted to ask you about your clinical trial because it's really exciting. It's one of the first rapamycin human trials that are in the pipeline. So can you tell us some more about it, please?
Yeah. So currently there's, just to talk about a separate study that's going on at the moment called the Pearl trial, which is one that Lifespan helped to fund. They're doing a fantastic job. What they're doing is they're giving rapamycin once a week and seeing what will happen to muscle and fat mass with a DEXA scan. And that's without exercise. So it's a really important study just to see what will happen if we just give rapamycin intermittently. And I think answering some interesting questions. The question that I'm wanting to answer with my study is what happens when you combine exercise and rapamycin together? Will we actually see greater muscle performance benefits or not? So the primary outcome is the 30-second chair stand test. So how many times can you stand up and sit back down in 30 seconds? And the age group that we're looking at is between 65 and 85-year-olds. So both groups will be exercising, but only one of them will be taking rapamycin 6 milligrams once a week, and the other one will be taking a placebo. So again, it'll be very interesting to see what happens to that 30-second chair stand test. And we wanted to use a functional outcome because when I see patients in the clinic, I don't necessarily care that much what we see on a DEXA scan. I care, can these patients walk further? Can they run faster? Are they less frail? Those are the things that I really want to know. And that's why we've chosen that functional outcome. So I think the Pearl trial and the study that I'm doing, I think they complement each other quite well. Again, my one's looking at the combination of exercise and rapamycin, and the Pearl study is looking at what happens if you just give rapamycin.
I'm looking forward to seeing the results. I want to ask another question. As a practicing medical doctor, what is your take on, the Fed, or let's call it, actually the longevity medicine, like longevity doctors, people who actually treat their patients or teach their patients to supposedly extend lifespan. Do we have enough knowledge and enough tools in our hands to do this?
I think all doctors in theory should be longevity doctors, right? That's our job. We should be improving the health of our patients and preventing disease. And that's exactly what I try and do in the clinic. And that's what all of my colleagues do in the clinic. They don't market themselves as longevity doctors, but we are preventing disease. We are trying to make our patients healthier. I think I just want to make sure that I say this politically. I think we need to make sure that any intervention that we're doing for our patients has got a strong evidence base. And when it doesn't have a strong evidence base, then patients need to be informed of that. So taking rapamycin, for example, I'm extremely excited about the potential that rapamycin will have for human health. We don't have robust human research yet, though, to support the notion that everyone should be taking rapamycin. There's a lot more human studies that need to be done. So personally, I don't advocate for people to be taking rapamycin or for rapamycin to be prescribed to otherwise healthy people. I think instead we need to divert those funds into studies such as the Pearl trial and the trial that I'm conducting. So, I'm still fundraising for my study, for example. So I'd love it instead of the money being spent on interventions that don't have a strong evidence base. I think it would be great for that money to be diverted to make that evidence base stronger.
For us to have an efficient longevity medicine, right, we need reliable biomarkers of aging, like widely available, not just in clinical studies. We already have some, because there's also some consumer products that start coming out based on wearables data and stuff like this. Do you see anything that you like in this field?
I think I'm a little bit different compared to most other people in the longevity community, because again, I'm a practicing doctor. So I think we've already got fantastic biomarkers of aging. I think, looking at patients' blood pressure, looking at their cholesterol levels, their HbA1c, their kidney function, their height, their weight, their muscle strength, how far they can run, all those things are what actually matter. And with the medicine that we practice, we're trying to optimize that. We're trying to, with a holistic approach, we're trying to make sure patients, again, have a good diet, regular exercise, good sleep. We're trying to make sure that their blood pressure is controlled, that their weight's controlled, that they are strong. So I'm excited about the potential, again, that, say, DNA methylation clocks will have. And sure, some people want to spend their money on that. I think there needs to be a lot more research as to whether those biological clocks will actually make a difference or accurately measure functional outcomes. And by that, I mean making sure that those clocks correlate with cardiovascular disease. We've got different clinical scores that will predict the chance that a patient sitting in front of me will have a heart attack in the next 5 to 10 years. And that's based off solid evidence. And we just need to make sure that any biological clock that's specifically designed to look at cardiovascular disease has a high degree of accuracy. So I think that these clocks need to be studied, they need to be validated. I'm not convinced that the general consumer would get much benefit from them at this stage.
Well, thank you so much, Brad, for this fascinating talk, and good luck with your clinical trial.